Good afternoon. How are you doing today? It's me, Digdarsh Kafle, a student nurse, and I am taking care of a patient named Jack Mazer, who is 53 years old. His MRN number is 110701 and his date of birth is 27 March 1969, and he has an anaphylactic allergy to peanuts. On Jack's situation, Jack has been vomiting and has nausea since 2 days. He's experiencing right lower quadrant abdominal pain since 4 days. He has tenderness in his lower right abdominal quadrant as per the medical officer. The medical officer, by doing further tests such as abdominal CT scan, colonoscopy and upper endoscopy, Jack has been diagnosed with diverticulitis. On his background, Jack lost weight significantly and felt very fatigued and has an episode of diarrhea over the last year. He ignored his symptoms as he thought it was because of his unhealthy lifestyle, where he had taken a lot of takeaway food and was busy with his university social and political activities and life. No medical or surgical history present for Jack. On the assessment of Jack is awake and has no any airway obstructions. It's clear, but he is vomiting. He is normally breathing. His rate of respiration is 18. His oxygen saturation is sitting a bit low at 94%. His blood pressure is systolic 95 and diastolic 58. The diastolic is a bit low, but since he is vomiting, that might have accounted into that. He has a heart rate of 110, which is more than the safe range, so that this is not in the flags. He is feverish with the low fever of 37.4 and is warm to touch. He has complained of pain and is in 10. The pain scale is 7. He has no any evidence of confusion. In his abdomen, there is a distended abdomen present, and the distension has not signified any sort of leaks, and there is normal BZL with no indication of hypo or hyperglycemia. No IV fluid has been administered yet. Since he is vomiting, he might be a bit dehydrated. He has been called in for the clinical review. On the recommendation, since he is vomiting and can vomit again, and emesis basin needs to be provided for vomiting, his vital signs observation needs to be taken in every 2 hours, and altered calling criteria needs to be followed if present after the clinical review is completed. Further BZL level testing can be done to check for any alteration on his BZL levels. His abdominal distension needs to be observed as well. A steady oxygen can be provided to improve his oxygen saturation and can be continued. Because of his diverticulitis, only clear liquid diet should be suggested, and IV fluid needs to be administered if the vomiting does not stop, and because of his nausea and and it needs to be confirmed by the doctor. He has a bit of a dehydration, and IV actually can provide a better solution for the dehydration as well. And his estimated discharge can be done within a week time and needs to be confirmed with the doctor.